I'm currently at the University of Mississippi Medical Center in Jackson, Mississippi. I'm working on a child health development project. It's a new grant that's funded through HRSA, and I'm with a cohort. We are providing child developmental health screenings for children ages 0 through 5. So we know that in the area of child health development, that the ages 0 to 5 is critical. And so being able to identify kids that if they need more assistance in speech communication, fine and gross motor, problem solving skills, being able to identify that on the front end so that those services, they can be connected to those services, help them get kindergarten ready, and then thus that helps to promote them later on in life and sets them up for success even better. So there's definitely that huge impact on the front line.
I currently work as a local health department liaison with the state of Utah in tobacco prevention and control. My main responsibility is to build and maintain relationships with our partners so that we can support them in the work that they do. So I grew up in poverty and I experienced all of its challenges, and I didn't realize until I was an adult that there are people and there are resources available to help those in low socioeconomic conditions. And I wanted to be one of those people, to help and make sure the resources get to the communities that need them.
Currently, I am a Director of Health Promotion and Evaluation. We develop programs locally, nationally, and internationally to help people manage a genetic disorder. So we work so that they can know how to manage that disorder and advocate for better care for themselves, empowering them and giving them that voice to do so. It matters because representation matters. I'm a Latina, I'm an immigrant, I'm a woman, and I think it matters to see people like me doing that kind of work. It matters to have your own people come in your community and not tell you how to fix it, but give you the tools so that you can use your own power to fix it. And I think that's what I can bring to the table. I bring that, the tools of health education, but the compassion and the cultural sensitivity to work with communities to allow them to develop the solutions to the problems that they face.
I am the founder and principal consultant for New Funding, which is a consulting practice dedicated to helping nonprofits who have a public health focus secure funding. Well, I started actually doing grant work in graduate school at the University of Utah, and at the same time I became a founding member of a small nonprofit called EATS, Eat Awesome Things at School, and I was able to immediately use that grant writing skill to help fund the programs that EATS did, such as school gardens, cooking classes, and taste tests. And then from that point, after I graduated, I launched my own private practice to help other nonprofits do the same kind of work. In the last few years, I've raised over $6 million for Utah nonprofits, and this kind of work has spanned from improving access for youth sports to, as I said, nutrition education and school nutrition, to most recently addressing the opioid epidemic that's devastating Utah right now.
I'm the director of a drug-free communities program, and we develop prevention strategies and different programs that we use toward educating both youth and the general community in our entire county about drug prevention. With this coalition, we have members from different sectors. So we have individuals from media, we have individuals from schools. So not only are we getting our prevention and awareness message about drugs and alcohol consumption out there, but we're really growing and building this community with a group of strong relationships.